Hi, everyone, and welcome to another episode of Live with PF and Pastor AK.
Yeah.
We kind of switched seats today.
Did we?
Yeah, I don't think we meant to, but
yeah, this is my good side.
Okay.
Finally, we captured my good side.
Very funny. How are you all doing? Just wanted to again welcome you to the show. And tonight we'll be discussing a topic that is kind of serious, but really, really important. I don't know if you've heard that saying before, that ignorance is bliss. This is one of those cases where ignorance is not bliss. This is one of those cases where, or topics that is really important.
People who say ignorance is bliss are just ignorant.
Okay.
Seriously,
all right, shots fired.
If you say ignorance is bliss, what you don't know won't hurt you. What you don't know will kill you.
Yes, in this case, literally what you don't know could kill you. So we thought it being October being Breast Cancer Awareness Month, we thought it would be really great to use this opportunity to talk about breast cancer. And the interesting thing is that the statistics are actually mind blowing.
It's ridiculous. What's going on?
And it's been pretty steady for years. One in eight women in just the United States of America alone will have a breast cancer diagnosis in their lifetime. This is the current statistics. And breast cancer is the most common cancer in American women, except for skin cancers, I guess, because of the sun and UV rays and and all of that. Skin cancers are also very common in women, but breast cancer is the top cancer, most common cancer in women in America. It's been estimated that in this year alone, 2020, approximately 30%, that's almost 1 in 3 women in America who have a cancer diagnosis, 1 in 3 of them will be breast cancer. Just let that sink in for a moment.
When you hear this kind of statistics, right, what it's actually saying, not to curse anybody, is that chances are somebody you know and love is going to get it. Is going to be diagnosed with it.
Yeah.
So this is something that we really need to know about.
Yeah.
There's a spiritual perspective to it, absolutely, and there's a prayer perspective to it.
Yes.
But you can't pray about what you don't know you're dealing with.
Yes. You can't fight an enemy you don't know, or an enemy you can't identify, or an enemy you can't
know exists.
Yes, you can't understand. Yeah. You need to be able to recognize, understand your enemy in order to fight your enemy effectively. So that's kind of what we're hoping that we'll be able to achieve tonight. Now think about this for a second. 3.5 million. There are 3.5 million breast cancer survivors in the United States alone right now. 3.5 million survivors in the United States alone, and millions of other women who may not, who may be lucky enough to not have a positive diagnosis would have had a cancer scare at some point or other in their lives. 3.5 million, that's a lot of people.
That's a heck of a lot.
That's a lot of families. That's a lot of financial costs with health costs. There are people, one of the highest or one of the top reasons for bankruptcy in the United States is medical or health issues. Yes, medical bills, medical issues, job losses. So it's not just the effect of the illness itself. It also has a social and economic effect, and as well as trauma. You would talk to women who've had or struggled with breast cancer, or experienced breast cancer, and there's a form of PTSD that's also associated with that, a form of fear and just trauma that is associated with that. So it's really something that we should be talking about, and not just out there in the medical world, but also in the church.
In the church. When we started the conversation, this is Breast Cancer Awareness Month. As you can see, I'm wearing pink. AK is wearing pink. Real men wear pink.
Yes.
When we started the conversation about Breast Cancer Awareness Month, I had some, peripheral knowledge that it's possible for men to get breast cancer. But even though it is rare, in 2020, it is estimated that 2,620 men will be diagnosed with breast cancer in the United States. And approximately out of the 2,620 men that are diagnosed, 520 will die. Right? That is what percentage is that? That's almost 20% of all the men diagnosed with breast cancer actually die, which is very high for any disease, So as a man, it's very important. As men, it's important that this is something we pay attention to. And I want to speak, to my brothers of African descent. We never really imagine or think that this is something that could possibly affect men. But it really is. And it's something that, we want to highlight a little bit tonight as we talk about breast cancer.
Absolutely.
The COVID pandemic has kind of suppressed a lot of the activities and a lot of the awareness exercises that are done every year for breast cancer, the marathons that are run,
the fundraisers.
A lot of things because of COVID has it's kind of quiet. So a lot of people have forgotten that this is Breast Cancer Awareness Month. There's a marathon they do in Dallas. I think it's I've forgotten the name, but that is not happening because of COVID. Usually that is what primes me that okay, this is Breast Cancer Awareness Month. But that marathon I don't think is being run this year. So we want to just take some time and highlight this important issue.
It's been overshadowed by a lot of other news, but something as simple as a personal breast exam could save a life. So this is one of the reasons why we want to.
I heard something that it's more likely to kill Black people than white people. Is that true? Or is that a consequence of the disparity in the quality of healthcare that Black people receive?
It's all of it. One is awareness. One is another thing is that some of the things that predispose people to breast cancer is just higher in Black women. For instance, and we'll talk a little bit more about this later.
Right, because we have a doctor, a medical doctor, OBGYN, who will be with us tonight, who we can ask some questions. That's a question I really like to ask. I'm really interested in finding that out.
Yeah, I mean, I have some thoughts, but let's see what she thinks.
And here she is. This is Dr. Jolaya Faturuti.
Hi, Doc. How are you?
Hi, Jolaya. How are you doing?
I think he's still connecting.
Okay, she's still connecting to us. The audio is still connecting. Yes. Hi, Dr. Jolaya. How are you doing?
Oh, well, how are you guys?
We're good.
Okay, thank you so much for taking the time, out of your really crazy schedule to be here with us tonight. We appreciate that.
We actually because we know how busy you are catching babies. I believe you are actually out of town now on a program. So we're really grateful that you made the time to talk to us about this very important topic.
Absolutely. So we kind of wanted to just pick your brains on stuff like, breast cancer detection, treatment, and just stuff to watch out for. I think maybe we could start off with how do you recognize breast cancer? How what are the common symptoms? How do you, as a woman or actually as a man as well, what are the little signs here and there that, you should get checked out?
Well, I first want to say thank you guys for not forgetting about Breast Cancer Awareness Month. Like you said, COVID has really made us forget about some of these important topics. But to start off, a lot of women usually come to my practice. I'm usually one of the first line physicians in this, multiple physicians who come take care of a woman with breast cancer. I'm usually in the first line. So women usually present to me, and usually the most common symptom, to be honest, is just having an abnormal mammogram. And so typically speaking, a woman will have to be screened for breast cancer. And at that time, we will then start to do the further workup. Other signs that, don't happen as frequently, breast masses can be detected on mammogram. Some breast masses, they may come with a breast mass that's not found on mammogram. About 50%, and about 30% of women.
Hold up, say that again. So some mammograms may not pick up the, a lump or a breast cancer?
Yes, And like I said, it's 15%, but it's still very real. And then in between mammograms, about 30% of women, between having a negative mammogram and for her next mammogram, they get a breast mass in between that. And so, usually these breast masses are very hard. They're very immobile. So, they don't move around, and they kind of have an irregular pattern. So some women get very nervous. They have breast masses associated with their periods and their cycles. And I always tell them those are less likely to be malignant and cancerous. It's usually those masses that are very hard. And then very, very, if the disease progresses and we don't catch it earlier as a mass, we might notice skin changes like redness. There's also this sign called pale d'orange. It looks like an orange, and there's little dimples in the skin of a woman. And also for men, all these signs are also common for men as well. And then sometimes, having abnormal nipple discharge, thickening, like a rubbery thickening of skin can be signs of breast cancer.
Okay. I've also heard of like an inverted nipple sometimes. I've known a couple of women that was kind of what...
Women get scared about this, but inverted nipples are actually a very common finding for women, so that's not really on our big radar of breast cancer, unless there's kind of skin dimpling or thickening associated with that.
Okay.
Yes, that could be a worrisome sign. Yes.
Okay. Are there different kinds of breast cancer? Because I know at work, every now and again we would get, chemo patients who are on chemotherapy, and there'll be sort of like different classifications of, what kind of breast cancer they have.
There are multiple types. I could spend 20 minutes just talking about
oh, wow.
cancer. But what I will say is the most common invasive breast cancer that you're going to hear about is going to be infiltrating ductal carcinoma. So about 80% of women will have that type of cancer. And then you have your ductal lobular carcinoma, and that's about 7 to 8%. And so those are just different terminology, and they're all based off of histology. It's what we see underneath the microscope. What I really want to talk about with the types is, the types that are different receptors. So you have your ER, your PR receptors, your HER2. Those receptors, you might have heard those names, are what we look at to see if a patient will likely respond to therapy. And so if you heard the terminology of triple negative, these women have no receptors to, any of the hormones, and therefore it's very hard to treat those women, their cancer. And that's where we hear about a lot of Black African-American women are more prone to getting that triple negative breast cancer, type of breast cancer, which is very, very aggressive.
Why? I mean, we're at risk for high blood pressure, we're at risk for cardiac disease, we're at risk for, some of the uterine cancers, and then this one as well. Is there any reason?
And, really the literature, is still developing. It's still, we're learning more and more about breast cancer, but we do believe that environmental, cultural factors do increase the risk. And so things that are very common to our population are our food, our weight. Weight is a big risk factor. Having high adipose tissue, which increases that hormone levels in your body, are thought to be some of those environmental factors. But let's not forget though, Caucasian women still are diagnosed the most frequently and have the most cases. But when we African Americans do get cancer, it seems to be more aggressive. And like I said, usually triple negative. And so that's why when I talk about types of breast cancer, it's really important to know the receptor type. Do you have positive receptors, which are going to likely respond to hormonal therapy, and you have a better prognosis of recovering.
I have a quick question. So sorry, just ignore my ignorance. You said adipose tissues. What are adipose tissues?
So that's the fat cells. The whole premises behind breast cancer is that you have an increased exposure to estrogen. And so fat cells, they can transform into estrogen more likely. And that's where you have that higher exposure. And so other risk factors as well are women who never had any children. So their levels of estrogen are higher. People who started periods early or they went through menopause later have a higher exposure to, estrogen levels. If women after, stopping their menses, continuing on with hormonal therapy, that's thought to also increase the risk of breast cancer. So anything that's increasing your estrogen levels are thought to. So alcohol intake, your food intake are all contributing factors to increasing your risk.
Okay. Can you speak a little bit more about nutrition? I know you talked about, our food, can you give a little bit more light on that?
So I always just, try to keep it simple, because I think that when we start saying Mediterranean diet, or we start to say this diet or that diet, people get very closed-minded. They get frustrated, and they kind of don't do anything. Yeah. So I have a mentality more of just lean protein, lean meat, being healthy, just simple things like, watching your portion sizes, and make sure you have a well-balanced meal. I like to keep it very simple. And really what's important is keeping your activity levels high. We can't figure out exactly why increased exercising decreases your chances and why it's protective, but we do know that exercising is a protective measure against breast cancer. So at least 150 minutes of exercise per week, of moderate exercise, or 75 minutes of high intensity exercises can decrease your risk long term.
Sorry, can you say that again? How many minutes?
At least 150 of moderate activity that gets your heart rate up, not high, but moderate. And then 75 minutes of high intensity per week can decrease your risk, especially after menopause. Especially after menopause, which is your.
So if I did like 30 minutes brisk walking every day, 5 days a week, 5 days a week, okay, and then I did like 15 minutes of, get my heart, pumping, maybe jumping jacks, burpees, that kind of stuff, or a 15-minute video, those high intensity exercise videos that are everywhere and they're free. Just doing 15 minutes of that every day could save my life. Is pretty much what you're saying.
Because remember, age is the biggest risk factor for breast cancer. So women between 25 and 49, that's about 1 in 50 women, right? But as you get over the age of 70, over the age of 60, we're looking at 1 in 14, 1 in 28 women are affected by this. And so, as you
get younger folks, so the risk factor is higher with younger women.
No, older women, but young women are not also excluded. So women who have higher estrogen levels, higher adipose tissue, they are at risk. That's a risk factor, which is that cultural and ethnic components.
Gotcha.
Oh. Quick question. You talked about estrogen, right? And I'm talking from the guy's perspective. When you think about estrogen, you associate it with women only, right? Is that something that men also, deal with? Is it the same thing with men? Estrogen levels causing, being a
risk factor for breast cancer in men.
You brought up earlier about 2,000 men that get diagnosed, and 500.
Almost 3,000 actually.
Almost 3,000, exactly, and 500, die from breast cancer. Well, one of their risk factors is the same as women. Men who have higher adipose tissue, fat tissue, have a higher risk of conversion to estrogen. So estrogen can be converted to estrogen in men and women. It's not exclusive to just women. Now, women, of course, have a higher risk, but men cannot be excluded. Same factors: eating healthy, working out, decreasing your fat level, decreasing your alcohol intake are all ways to decrease your risk.
Okay. I love that, because you hear a lot about detection, early detection, but I'm not sure we hear so much about how just diet and exercise. It just seems like what you eat and how much you work out just seems to affect everything.
When we think about nutrition, right, we don't really associate nutrition with breast cancer. We associate nutrition with cardiac issues, with blood pressure, with cholesterol, diabetes. But we don't often, realize that the fat can be converted to estrogen, and the estrogen can be problematic.
I mean, we could do a whole talk on obesity. People don't realize obesity in this 21st century is at the center of a ton of morbidities and problems that we're having right now in America. We can make a list of how obesity translates into multiple different problems, not just diabetes and high blood pressure.
Gotcha. So with breast exams, how often should we be doing that? And should men also be doing that?
So, the literature is ever changing. When I was back in medical school, I was taught daily breast exams, but there's been new literature coming out by most of the big bodies out there that states that we really shouldn't be doing daily breast exams. We should be aware of our breasts. So a lot of women who detect breast masses are taking showers, they feel something, they're putting on lotion, they're scratching, and they say, oh, that's different. And so that's important for you just to know your baseline. Know your body, be aware of your body, be aware of how your body normally looks like, what's normal for you. And if you detect any changes or anything that's different, notify your physician and let us be able to go ahead and do the necessary workup. The biggest and most important thing is to keep your exams with your OBGYN. So every woman out there, I mean, especially if you're over the age of 40, you should have had a mammogram by now. If you don't have a mammogram, I mean, you're putting yourself at risk. Most of our breast cancers and most of our success with decreasing that risk or decreasing the occurrences are due to mammograms. So when you're over the age of 40, you should be getting an annual mammogram. Now, there's some literature out there stating that you can do it every 1 to 2 years, but I err on the side of caution a lot. So I do yearly with my patients. At the age of 25 to 40 to 39, you should be going to your doctor so they can do an annual breast exam. They can palpate and show you how to be aware of your breast so that you can detect a breast mass. Now, once again, it's not perfect science. A lot of times you're going to miss it. Like I told you, 30% of people are going to miss it. But still, that can decrease your risk.
Absolutely. So if you shut like every door, chances are there's less risk of stuff getting through. What about family history and, the how important or how crucial is it to do the BRCA testing?
So I always just start off with people this because people get very scared, but truly and honestly, most breast cancers are sporadic. There is no genetic tie, there's no genetic cause, it just happens spontaneously, right? Now there's a 5 to 10% chance that is due to having a genetic disease. The most common, of course, being the BRCA1 and BRCA2. And so, once again, going to your OBGYN is critical. So when you go, they'll go over a survey of questions, whether you've had an early family history of breast cancer, whether you've had ovarian cancer, a male in your family having breast cancer. These are all signs for us to do genetic testing. And so most genetic testing are actually going to test for an array of factors that can cause breast cancer or cause different genetic abnormalities. And the great thing about the US most recently, most insurances are covering genetic testing. So it used to be that it was jumping through hoops to get any kind of genetic testing. It was frustrating. But now it's been widely accepted with most insurance companies. About 90% of them will take your request for getting genetic testing. And so I recommend everybody have a candid conversation with your OBGYN, know your family history, know why the people in your family, when they pass away, what did they pass away from? So you can have more knowledge, more power, so that you can get the right testing, especially for the next generation.
Quick question. A lot of, you said something about know why people die. I come from Nigeria, and a lot of the times people die and an autopsy is not done, right? People are ill and we don't always know what is wrong with them, and so
the obituary just say died after a brief illness,
right?
That kind of like catch-all.
So is this basically? I think what you're basically saying is we should have conversations with our physicians about these issues, because somebody may have died and you don't know that person died of breast cancer, or a guy may have died and you don't know he died of breast cancer.
Especially the guys, because most men that I know, chances are they're not going to be upfront about having breast cancer. There's just a bit of a stigma still, there's a bit of a secrecy kind of way shrouded in that you just.
Especially with African American, I'll be quite honest. We just have a secrecy or not telling everyone. And so, you know, I tell people to start with yourself, start with your generation, start with your family. Record your history, know your history, and let your kids, your children know about what is in your family. You know, you might not be able to go back generations, but start now and have a transparent, open conversation, you know, with your family about, you know, what their risks are, what runs in the family.
Yeah, makes sense. Interestingly enough, I actually lost my oldest sister to breast cancer just a week before she turned 41. So she passed away at 40. And it's just been one of those things that's kind of hung over. There were four of us girls. So with all of the women in my family, it's just been something that's kind of hung over us. And last year, I actually went ahead and got the BRCA test done. And just if nothing else to kind of give you a peace of mind. And again, like I said in the beginning, I realized after a while that ignorance wasn't bliss. You know, just ignoring possibilities was not a healthy or sensible way of thinking. You know, and that also leads me to ask, so how important is early detection? Because I know with breast cancer, you know, maybe you could just talk a little bit about the stages so people understand why we harp so much on early detection.
Yeah, so actually since the 1970s, the cases of breast cancer, people dying due to breast cancer has decreased tremendously. And it's mainly because of the fact that we are detecting breast cancer or locally invasive cancer before it spreads sooner. And that allows us to do the necessary treatments, necessary workups, necessary preventative measures from it metastasizing. And so it's very critical. I mean, once we get to an aggressive form of breast cancer, and the stages are also very complex too, but once we get past that 3, 4, you know, level with breast cancer, we're talking about it being in your lungs, being in your bones, being in your liver, places where, you know, at that point in time, it's very difficult to treat and eradicate breast cancer. And so catching at an early stage while it's a small mass or while it's still locally invasive and intervening aggressively allows us to treat that. But a lot of times people have problems detecting it early due to access to healthcare. And so if you don't have an OBGYN, if you don't have a doctor, a primary care doctor, you don't go to a doctor, you don't get your mammogram done, you don't get it detected until you can feel a large lump. And then at that time, you know something is wrong. And so I always just say, you know, plug in with any kind of health insurance that you can, and make sure you know your risk, you know what's going on with your body.
Yeah.
Don't wait till it becomes so aggressive that it's difficult to treat.
Do you know if there are any free programs or any sponsored programs for women to get mammograms or stuff like that? Is there anything out there?
So I've just recently moved back to Texas, and you know I am definitely on a mission to know more about the programs in this area. So if I do in fact find those in this Texas market, I will let you know. But I don't know of such. But from my understanding, mammograms, you know, they're affordable. Even out of pocket, they're affordable. They're of course not cheap, but they're affordable. And you know, one has to just really put their health at the
As a
forefront.
priority, yeah. Because actually, mammogram will always be cheaper than chemotherapy.
Basically, you should not be buying Louboutins if you have not had a mammogram.
That's it, Pastor. You said it. That's it. That's
Okay.
it.
What about the impact of stress? Because I know one of the things that PF had asked earlier was, you know, what are some of those risk factors? Why are the aggressive ones prevalent in Black men? I know you answered some of it with stuff like diet, exercise, access to healthcare. What about stress? Does that in any way, you know?
So, you know, the literature is wildly varying. We can't come to an agreement. So there was an article that was published saying that women who worked night shifts, they were at increased risk for breast cancer due to stress, but there's no consistency in the literature. There's not enough volume of studies to demonstrate that's the truth.
Yes.
You know, so I can't really say that's the case, but that has been floated around, you know, and so there's no clear consensus of the link, to be honest.
Let me ask a question. What about breastfeeding? I've heard that, you know, that.
Yes. So one of the other protective factors besides working out is breastfeeding. So at least 6
For real?
months. 6 months at least, and I always advocate this. I'm talking, your babies are smarter, have a higher IQ. I can go on about this, and you decrease your risk for breast cancer. And the same also applies to birth control as well. There's so many benefits to birth control, which the thought process is that you're decreasing your estrogen exposure. So when you breastfeed, you're decreasing that estrogen exposure. When you take birth control, you're decreasing that estrogen levels, and just keeping it at bay, to decrease the chances of that cells turning over and becoming cancerous.
Gotcha.
Okay, let me ask one question, last question before we let you go. I know you've got a lot going on. Yeah. In men, are the symptoms similar, or is there anything that we need to look out for that's a little different?
So I'll be quite honest, especially men who are obese, it's the same thing. You should know your body. And so, if you have gynecomastia, which is basically male breast, you should know your anatomy. But it's similar symptoms, having breast pain, having breast masses. The only thing about men, because it's not enough awareness, is that when we detect it in men, this is what I've read. I don't take care of men, but when we detect it in men, it's more aggressive, and is likely due to the fact that we're catching it later. Right. So women are more likely to get those mammogram screenings, are likely to get, tested appropriately, while men are not looking out for it. So I really encourage any men, know your anatomy, know your body, know yourself. And if you detect any abnormalities, let somebody know.
Gotcha.
Fantastic. Thank you so much, Dr. Jolai. I mean, this has been so informative for me. We have this superficial knowledge of these things, right? Yeah. But hearing you describe it, I think I understand it a little better.
Yeah.
And it encourages me to make sure that all the women in my life, that's one of the things I'm going to be telling people now. Hey, have you had a mammogram? You need to go get a mammogram.
Can I leave on this note? Like Pastor said, we have 3.8 million women who are breast cancer survivors. And it's all because of screening, of early detection, of knowing, your body, and getting that. So, I commend all the women who have survived, who are surviving. And I encourage all women just to know your risk. Know if you are at risk for having breast cancer. Get your mammogram, please. I beg you. So thank you for having me here, guys.
Thank you.
Thank you so much. Thank you so much. We're going to speak with some people who have survived breast cancer. So we've heard from first-hand experience. Yes. And we thank God that they are here to share their experience with us. There are so many people who have dealt with this disease and did not survive it. So I'm really grateful to God that they are able to join us to talk about their experience with breast cancer. We've got Reverend Margaret Sims, who is going to be joining us. We've got Zarina, who will also be joining us, and I think they are on the screen already. Hi, guys.
Hello.
Good evening.
Good evening. Thank you so much for joining us, Zarina.
We appreciate it.
And Reverend Sims, thank you so much for being here. I know how busy you must be, being in the ministry myself, so I am super grateful. Super grateful that you could join us as well. Yeah. Oh, and by the way, Reverend Sims is Kendria's mom. Kendria is one of the producers of this show. Yeah. And it's just wonderful that we could have Reverend Sims with us and Zarina May. Thank you guys
really
so much.
Appreciate it. And we know it's a big deal to share your experience, to be vulnerable, to let people know, because still in the church, there's still that kind of shroud of secrecy over it, and just not putting my business out there. So we appreciate the sacrifice that you're making in order to have people have the information. And I know that this show may save several lives, because somebody is going to go away from this and do something, or make a decision either in reducing their risk factors or in getting an examination that will save their life. So we want to really appreciate you, breast cancer warriors. Thank you so very much.
So,
Thank you for having me.
quick introduction. Reverend Sims is a mother, she's a grandmother, she's a pastor, she's a warrior, she's a survivor.
Yes.
And by the grace of God, she survived stage 2 breast cancer, diagnosed at 65, underwent chemotherapy, radiation, a mastectomy.
Everything, like you did it all, ma'am.
Yeah. Zarina, diagnosed at early 20s.
Yeah. So the other side of the spectrum.
Yeah. Excellent. So, AK.
So we want to find out. I don't know what it is about it, but I'm just fixated on early detection. It just seems like if a woman is going or anybody is going to have breast cancer or any kind of cancer, early detection is key. So I want to start by asking how were you diagnosed? How were you? How was it detected? Was it a?
We'll start with Reverend Sims.
Yeah. Mine was through my mammogram, and in 2013 I missed my mammogram. But in 2014 I did my usual mammogram and was shocked when they came back and told me that they found a mass, because cancer does not run in my family at all. Now, I have a great aunt that passed away from colon cancer, but that's the only indication of any kind of cancer in my family. So I was shocked because I'm used to getting mammograms and coming back everything negative.
Yeah.
So I was very shocked.
Yeah.
When they
Before
told me
that, about how many mammograms had you had? Just to
when you consider my age, I've had like a lot of mammograms. I'd say at least 10.
So we can't get lazy and think, oh well,
right. Yeah. So you have to have, So that was the first time I ever skipped it, and then I was like, I can't believe I did that, because I retired that year in 2013. It was really 2014 that I was diagnosed, and I was surprised. But then you never know what God is doing.
Yeah,
absolutely.
Yeah,
I knew something was going to happen in 2014 because I was at church, and in another church, and the choir was singing, "Because He lives, I can face tomorrow." And when I heard that, the Holy Spirit impacted me so much. My mother was sitting next to me. I just cried the whole time. Cried. I said, Lord, I don't know what's going to happen in 2014, but whatever's going to happen, you fix me.
Amen.
And make me ready for it.
Amen.
That's what I did. And so, but I knew something was going to happen. That March, that's when I discovered that I had the cancer. But I didn't panic because I knew God was going to take care of me.
Amen. Praise God. Thank you so much for sharing that. And Zarina, what about you? How were you diagnosed?
Because we think early 20s, you probably weren't thinking in that direction at all.
No, not at all. I actually, so first and foremost, all women should be doing breast exams consistently, because I found something kind of on accident. It was really small. Maybe I want to say so small, I almost didn't know it was there. I would say like pea size. Like I wasn't sure that it was something. And so I probably let that go on for a few months actually, and then noticed that it was getting bigger. So I didn't know where to start really with that kind of thing. And I wasn't at the time even really seeing a physician annually. So I was going just somewhere because they had women and breast in their name, and saw a nurse practitioner. She felt it. She was like, oh yeah, this is most likely benign. It's super common. I forget what she called it, but she said, it's going to get bigger, so you should have it out. But generally, she kind of told me that there wasn't a whole lot to worry about. So again, I was like, okay, well, then I kind of need to figure out the next steps for this. Maybe another month went by. I kind of dragged my feet about it a little bit just because I didn't think that it was anything, which you should never do. You should get it as soon as possible. And then that time got even bigger. So finally, and then I started to have chest pain, and that kind of concerned me. So I thought, okay, I need to go deal with this now, because it was almost like debilitating. I remember being at work being in so much pain and not being able to sleep. So I had no idea, honestly, where to go. That's kind of the tricky thing about our medical system, is that you have to see like 5 different doctors to treat one thing.
Yes.
And I didn't know who to go to get referred. So I just said, okay, well, I need to see someone today. So I just went to a physician, and I figured she could maybe at least refer me to someone who could fix it. So she felt it, said the same thing. Oh, this is really common in women your age, most likely benign, and sent me off to get a mammogram. And that person sent me to a breast surgeon who did the biopsy and told me that I had breast cancer.
Wow. So if you hadn't persisted, they kept saying it was benign, it was benign. If you hadn't persisted, then, it could have gotten out of hand.
What stage was it at by the time it was diagnosed, if you don't mind my asking?
So they were actually, my doctors were really like weird about not telling me that. And I ended up finding out sometime during chemo, actually. No one ever said to me, I had to ask. And I only asked because I saw my paperwork when she was giving me the drugs. It said like stage X. And I was like, oh, I don't know what that is. I hope it's nothing like worse than what I was thinking. It turned out that I was stage 3.
Wow.
Yeah, because I let it go on probably, it was probably 6 months before I saw the breast surgeon who diagnosed me.
So from the time you felt the pea-sized lump to the time you were diagnosed, right? It was about 6 months.
Mm-hmm.
And in 6 months, it had gone up to stage 3.
Oh yeah, and it had gotten pretty big. I want to say, if I had to guess, I would say like gone from that pea size to like very obvious like avocado pit maybe size. It was pretty big.
It's 6, because when you hear these things, right, you think it takes years.
Yeah.
You think the progression, takes a long time. So hearing you say, describe the progression, so quickly, and hearing Reverend Sims saying she skipped a mammogram in 1 year, right?
Yeah.
It just, it just, I feel cold.
Yeah, I have goosebumps.
It just
all the way down my
really
arms.
freaks me out. It's that quick.
Yeah.
Well, that is so from what I understand, in younger patients, it tends to be more aggressive. So younger women, especially if you feel something, it usually progresses more quickly than in older patients.
I did not know that.
Mm-hmm.
So how if you don't mind us asking, Reverend Sims, how did that feel, hearing that diagnosis, especially as you'd kind of had a warning?
Like I said, I was shocked at first.
Yes.
But I didn't notice any difference in my breast because the growth was in the nipple, and I was checking everything else, but not the nipple,
Oh.
So I wasn't aware of that. But what got me through was my faith in God. And then when I went to him, I thought, well, he's just going to zap me and I'm going to be healed right away. But that's what happened. And so when I went to him about it, he said, I'm not going to zap you. He said, you're going to go through the process. And I said, why? He said, because you'll love me more out of it. And I did, and I still do. I love him more because of what I went through. It seems crazy, but I do. And sometimes God has us to go through things, unexpected things.
Yeah.
And it was hard on my children.
Yes.
And Kendra was the first for me to tell her. And she is the baby. And she was like, this is not fair. Because Tamara was way in India and Jonathan was in Florida. And I didn't want her to tell them yet. Yeah. And she said, this is not fair for me to have to deal with this by myself. But she had a Mecca. And I did tell them, eventually, but it was hard for them. But, God brought us through.
Yes.
You said something that blew my mind. I didn't realize, like, in the nipple. I'm sure most women are like.
And I will tell people, check the whole breast, and especially the nipple, because a lot of times that's where the cancer is being lodged.
Mm-hmm.
Just that information alone is something I'm sure that will save a couple of lives, because people wouldn't be thinking that, So
and I was stage 2.
Stage 2, wow. I know you kind of touched on it a little bit, but can you give us a bit more detail about how that affected your faith? You know,
Well,
that's another of the things I struggle with. Why me?
yeah. Well, I was shocked because it doesn't run in my family. And when I told my family, they're like, "What?" Because we that's not something we have high blood pressure, but we don't have that.
Yeah.
And so but it didn't because of like I said, I heard the Lord speak to me through that song because I can face tomorrow because he lives, I can face tomorrow. I was already pretty much ready for something. And so I knew something was going to happen, and I knew it was going to affect my faith in some ways, but in some ways it was like I was like grounded in him. And so I knew that whatever I was going to face, that God was going to bring me through. So even though it was very painful, it was, I went through a lot, those chemo, because I have always had a problem with being nauseated. All three of my children, I was nauseated the whole time. So it was hard for me to go through all that being nauseated the whole time because the chemo is no joke. It's really difficult, but God brought me through it, and I don't want to get ahead of y'all, so
No, it's perfect.
Yeah. So when I was had the chemo, it was 6 weeks of chemo. And then you have 6 months of chemo, and then there were 6 cycles, and there was the fourth one. You had a rest period. Then you go back over again. You do the same thing over again for 6 whole months, and then they were trying to reduce the tumor before I had the surgery. So then when I had the surgery, I can't explain it, but I didn't have any pain. They kept saying, you need to take your pills because you're going to be devastated because the pain is going to get you so strong. But I never had any pain.
Wow.
And so I knew that was God, but I didn't have any pain. But the thing that I did do is that when I had reconstruction surgery, I think I got a little bit too cocky, so to say, And so after I had the reconstruction surgery, I started doing what I usually used to do, fast. You can't fast when you've been sick. And so I didn't realize that I wasn't supposed to be fasting. And so that's what I was doing because you need
Strength.
you need strength and you need food. And I was used to fasting like 3 times a week and all that kind of stuff, for my church and people and everything. And so they told me this is not good. I wasn't, responding like I should have.
Okay.
So that was a big lesson for me,
Wow. When you talked about that song, because he lives, I can face tomorrow, it really resonates with me because sometimes we don't pay attention to the Holy Spirit and the way that he speaks to us and the way that he prepares us for what is coming. So that touches me, that we have to constantly be listening. Sometimes we miss his signal, we miss his warnings, because we're not,
So when end up we're not battle ready because we're not prepared.
That's awesome. This is very, I'm really curious. You were in your early 20s. How did the people around you react? Because, if somebody who was in their early 20s said to me, they got diagnosed with breast cancer, I'd be like, you've got to be kidding. This is something that happens to, older folks.
Yeah. So I told my family first. I didn't really tell anyone else. And people, it kind of just got around, I guess, the longer it went on. So when I found out, I was actually at work because the doctor wouldn't, she tried to call me like the Friday before but asked me like where I was. And because I was driving, she wouldn't tell me anything. So I was like, ah, crap, I know it's bad, but now she won't tell me. So I had to wait until Monday. And I lied and told her I was home so that she would just tell me the truth. So that was really how that happened. I told my sister first, one of my oldest sister, because she had known that that I had found something, and that I was getting a biopsy done. So I told her, and then kind of one by one, I just told everyone. I think I told my mom last just because thought that she might have the biggest reaction.
Mm-hmm.
But she actually was pretty calm about it. Everyone was relatively calm. Everybody just wanted to know what they could do to help. I guess in my family, it wasn't like people were surprised, obviously, but it is something that runs in our family. My mom had it twice, actually. And I believe my grandmother did, her mother did too. And actually, we found this out after my diagnosis, but she actually is what's called, so there are two genetic mutations that you can have most commonly for women with breast cancer. It's an acronym BRCA, BRCA1 and BRCA2.
Yes.
And my mother has a BRCA1 mutation, and I also have it. But so when she got her test done, she got it done like a year before my diagnosis and didn't get her results until after I'd already gotten mine. So we knew why I had it. It was just, it's not good news for anyone,
Yeah.
So let me ask this, how did this affect your faith? How did this affect you emotionally? I can imagine, but what were the thoughts that were going through your head when you got this diagnosis?
Honestly, there was some anxiety, especially in the beginning, but if anything, I would say just numbness. Like I just knew I had to get through it. So for me, at the time, I thought that strength was kind of just putting your head down and doing it. So if anything, I neglected my faith, my mental health. I neglected so many things. Just kind of, I didn't really lean on anyone. I mostly just, it's hard to describe. I would almost describe it as like being on autopilot for the process. And I remember very little during that time just because I was there, but I wasn't really there. So everything kind of just stopped.
Okay.
I would include my faith in that. I neglected that just as much.
Right. Okay. Did you face any obstacles, during the treatment? Were there anything that was going on that made it harder? And how did you deal with those obstacles?
You talking to me?
Yes.
Well, I had some obstacles in that the nausea is what affected me the most. I think the reconstruction surgery was the most difficult one because I came through the first one almost like with flying colors, but the reconstruction surgery, I had a 10-hour surgery where they were taking the um, vessels from my stomach and everything and putting it in my breast. And that was a very difficult surgery. I of course didn't feel it, but they did, And my doctor was excellent, but God is the one who brought him to me, and that's kind of strange what happened there because I was going to have another doctor, but God brought this one to me. He was a Christian, and that's wonderful. And he said even during the surgery, he said he felt very much at peace because we had all been praying. And I came through that, but the recovery was because I did things I shouldn't have been doing. They told me not to pick up anything. We had gone to a church meeting in San Antonio, and I was picking up I wasn't supposed to pick up any luggage, but I was picking up some luggage, my mother's luggage. And when I did that, I could feel my sutures, everything kind of broke. Yeah. And so I had went back to the doctor, and that's when he told me, no, even when I had that surgery, because I have an upstairs, I don't have it now, but I had an upstairs home then, I downsized since then, and I couldn't go up the stairs. So my children, we already had a recliner there, and I wasn't able to lay down. I couldn't lay flat. I had to sleep in the recliner. I couldn't go down the stairs. I couldn't go up the stairs. So they brought the microwave upstairs in the loft area, and they brought the mini refrigerator upstairs. And so that was a difficult process. And then not only that, that came through, but then I also had what you call a hole in my stomach for the drainage, and that got infected. So those are things that happened to me. The first surgery was fine. The second one, that was more difficult.
Well, I'm so glad that you're here,
Yes.
that you got through it. You know, Zarina, what about you? Did you face any obstacles?
During treatment, not really. There wasn't anything in particular. I did have one kind of surgical complication, I guess. So it sounds like you had a different kind of reconstruction than I did. There, you have a few options. There's one where they can take other parts of your body, other tissue, and put it where your breast tissue was, or you can get implants, or you can just do nothing.
Mm-hmm.
But prior to getting implants, I had to stretch out that part of my chest again. After having it removed, so they put something in there. I forget what it's called.
Like a shunt?
Kind of, kind of, and basically they fill it up with a little more saline every 2 weeks so that it gets bigger. And at some point, I don't think I did anything. Maybe I was exercising or something, but for a few days, I felt like a sharp pain in my ribs. And that's how they attach them. They stitch them down to your ribs. So I went to the doctor and I was like, yeah, this is painful. He's like, is it like a stabbing pain? I was like, yes, very much so. And also one of them felt like softer than usual. And I was like, I think it's deflating or something. And he was like, no, that's normal. You must have just jostled the stitches or whatever. It feels fine. It looks fine. I was like, I should have listened to my gut. That's really a big thing that I learned during this process. You really have to be your own advocate because the doctors don't know what you're experiencing.
Absolutely.
You really have to stick to your guns and you have to listen to yourself because a week later, it was completely deflated. And I probably didn't go back to him for a few months. I'm not sure what they would have done anyway, maybe replaced it, but I didn't want to have surgery again or like keep inflating it and then having it leak again. So it didn't really change anything for the final surgery where they replaced them with implants. So yeah, that was not fun though. It actually hurt for almost the entire time that they were in.
Yeah.
Wow.
I think that's really important what you said about advocating for yourself, because I've been reading some stuff over the last couple of weeks, and it's really about medical complications that could have been avoided, and sometimes they're actually fatal, where a patient is saying, "This is how I feel," and props to the medical personnel. I mean, I'm a pharmacist, so I know that they do their best, but in cases where something is not the norm, I think that's where it becomes a bit of a problem, where they see 1,000 cases and it's all going in this direction, and you're the one person who's going that direction. Just insisting that no, I know myself, I know my body, I know how I feel, and this is not normal. Advocating for yourself, I think that's the way you put it.
I think that's critical, in any interaction with healthcare. You have to be ready to advocate for yourself. You cannot, put the responsibility on other people to describe how you are feeling and to insist that you get the help, that you receive the help that you need. As a pastor, one of my biggest concerns in this conversation is how do we as a church community provide support, for people who are dealing with this challenge, because, it's one of those things that we don't talk too much about.
So sometimes you just don't know what to do.
Or what to say. So Reverend Sims, if you can, I'd love some pastoral advice.
Yeah, because you've got it both ways, being the pastor and being the patient,
I have to say that the church was very supportive. But the thing is that she's strong, but you need to realize we may be strong sometimes, but when you go through something like that, you need the prayers of everybody, of the flock and of everybody. And I would say that most important is that they know that you're getting that you are thinking about them, and that you don't always have to call them every second because they're not always feeling that good. But just send them notes and stuff like that, and sending some packages, food packages helps a lot because I wasn't able to cook, and Tamara was always right there. My family was always there for me. But see, when you're incapacitated, you can't, you know, provide for yourself. You can't cook for yourself and stuff like that. So it's good to have, food packages for them, and just sending little notes to say we're thinking about you, we're praying about you. It's so encouraging because sometimes you feel so isolated and all alone, and sometimes you feel like even though you may be strong in faith, sometimes you feel like, Lord, why am I going through this? And it's just good to know that people care.
Did you mind people talking about it, or it being kind of like public
No,
knowledge?
I didn't mind people talking about it, but because I'm just kind of independent person, I would tell my family, don't hover.
Okay.
So they were like, I think some of the family members got offended by that. But my mother, she is a very all about her children a lot, and so I just didn't want her to hover over me constantly. I just wanted that independence and I wanted that peace because by her hovering, it made me think I'm sicker than I really am. You know what I mean?
That's
She didn't
right.
mean any harm, but it's just that was the way it was.
Yeah.
So I just think it's just important that you just send messages, notes, and let people know that you love them.
Did
But back
anyone
then,
actually ask outright like what you needed? Because people are so different. That's the challenge that we face sometimes. One person loves and appreciates, another
yes.
person it hurts or offends, or it's too much or it's too little. So
Hmm.
even as a pastor's wife, I struggle with that, having to tailor, my responses to people's needs, as well as thinking about the kind of person that I am, because I've gone through several breast cancer scares.
Hmm.
I've had a couple of mammograms that they saw something. I've had
Hmm.
what do you call it? One of them where they actually had to do. My mind just went blank. A biopsy. Yeah,
Yes.
I didn't get my results for a while, but in that whole period, you're still ministering. You're praying for people. You're counseling with people, and you can't like switch up and say, look, right now, I mean, I could, you know. And so being used to, like you said, being used to being strong for people, it when you flip the switch, it's just so confusing.
It is, it is. But I have to say this, scripture is what grounded me. And sometimes people will send scriptures. Back then we weren't on Facebook because this happened in
2014.
2014, and we may have had it then, but I didn't have it.
Yeah.
Um, but now it's very good to know that we can have that. But back then we didn't have Facebook and all that. But sometimes when someone would send me a note of scripture, because scripture it's always something that grounded me. When I would get a wonderful scripture by his stripes I'm healed, and by his stripes I dwell on those myself, but it's good to get it from other people. And I am the Lord that healeth thee, all these things. And just good scriptures is what kept me going. And I feel like it keeps a lot of people going.
Yes,
Just
it
good
does.
scriptures.
Actually does. Thank you so much for that. Zarina, can I ask you a question? What advice would you give, to folks, to women who are facing this diagnosis or fearing, like my wife, I remember when she had the scare, it was really tough, for her. And all I could do was just be there. I knew there was not much I could say.
Mhm.
But what advice would you give to the people who are in it?
I
So the
think
people
the
who
first,
are,
go ahead, you go ahead.
oh, so I'm sorry.
No, please go ahead. I want to hear from you.
To people who are starting, who have been diagnosed, I would say more than anything, the thing that I regret most was not staying present, because it really affected me afterwards. Once it was over, I didn't even realize how like mentally sick I was. So after it was over, I kept waiting to get better and waiting to feel better, and not realizing that, one, it has some effects. So you're not just going to immediately be better, but also that something was wrong with the way that I was thinking. And that was why I was feeling bad, was because I hadn't taken care of myself mentally. I hadn't taken care of my faith. And I had really neglected myself. So more than anything, stay present. It's probably good to talk to people who are going through something similar. Go to the support groups. And that, I think that would have really helped the situation.
Thank you. That's really profound. Reverend Sims, what advice would you give?
I think every person is different, because some people like you to be there, every second, every minute, and other people do not. But I think you need to let people know more than anything you didn't do anything wrong. That trouble comes.
Yes.
In all kinds of ways, And sometimes, because I kept going up to myself, I said, "Well, I eat right, I do this, I do that. Why did this happen to me?" But you can't put yourself down like that. You have to know the trouble comes whether you did anything wrong or you did not do anything wrong, or you did something wrong. It happen. Satan is real. And so you just have to let yourself know that God loves you, no matter what is going on in your life and what he sends in your life. It's not because he's punishing you. Just like he told me, he said, because I love you. And because you're going to go through this, I'm going to increase your love for me. And this is exactly what he did. I just think it's most important that we know that God loves us no matter what we're going through in life, just like Job. And that God's got another answer. He's got another blessing bigger than what you have right now and bigger than you, because he is all powerful. And he always has a purpose, even in our suffering.
Amen.
And I was reading Genesis, I think it's chapter 50, where Joseph said to his brothers, "You meant this for evil."
Yes.
But God, meant it for good, to save generations from starvation. I like what you said, and I think it's something that Christians need to hear.
Over and over and over.
We will have troubles. There will be challenges in this world. The Bible says we will have troubles, but the love of God is constant. It is not an indication of God's pleasure. Because I grew up in a Christian tradition where if there's anything going wrong in your life, it means that God is unhappy.
Check
with
yourself. You've done something.
You've done something.
Yes.
You've got one secret sin, and if it's not your sin, then but I love what you said, and I really appreciate that. And Serena, I really, one of the things that I've realized is that when we're focused on solving a problem, we sometimes don't focus on the impact the problem is having on us mentally. And when the problem is solved, right, we don't necessarily mentally immediately recover. So
that having your whole body out of balance, spirit, soul, and body. We ignore that a lot in the church. We focus on the spirit, and these days now we talk about the body, but we haven't really keyed into the part that your soul and your emotions and your mind and all of that really kind of like sync everything together. And it's just in the past couple of years that the church has started to really talk about mental wellness.
Yes.
And how things affect mental wellness. Yeah. Well, thank you guys so much, Reverend Sims. I am so grateful. I'm glad to finally meet you. I've heard a little bit about you, and I'm glad.
And we did pray for you as well.
Yes.
Thank you
so much. And Serena, thank you for sharing your story with us. I know that a bunch of folks have been blessed by this. So God bless you both. Have a wonderful evening, and the
Lord keep you. God bless you.
God bless you.
Thank you.
So that was interesting. It was pretty intense.
But also informative because of my background, and personal experiences and loss with breast cancer. There was and just being in the medical field, there were things I thought I knew, but there was stuff that I learned tonight that I had either not ever known or even really thought about. And again, I love what Reverend Sims said at the end, where just being focused as a Christian on God's love. I think we cannot overemphasize that, because the first things we tend to ask as Christians when something negative happens to us is, why me? And it always seems subconsciously like a punishment. It's just something that is ingrained in a lot of us, where we feel that if I'm right with God, then everything is just going to be rosy. And it really is actually quite unscriptural.
You know what? I'm actually going to be preaching a sermon on Sunday on something.
Oh, I didn't know that.
Yeah. I'm talking about.
I didn't know.
We're talking about prayer.
Yeah.
So we're going to be talking about answers to prayer.
Yeah.
And why there sometimes is a delay and why there sometimes is a no. So join us. On Sunday, 10:30.
Yes.
On YouTube, on Facebook, on our website, newchdallas.com, on our app. This is a sermon that I think will bless you.
Yeah, absolutely. So next week, we are going to have a very interesting show. I really encourage you, don't miss that. It's going to be hot topics. So we are going to be diving into, current affairs, what's going on in the world around us right now. So all of it.
We're going to be talking about what is going on in Nigeria I'm so inspired by our young people.
I know, like it's incredible.
I'm finding it
I keep reaching myself like, is this?
Finally.
Yeah.
We're going to be talking about it. We're going to have some guests who are on the ground,
and have first-hand experience
of what is going on.
People who are making a difference, who are part of, the drive for change, who are actually putting all of themselves, their money, their mouth, where,
And we're also going to be talking about COVID. COVID has not gone. Miss Corona has
an update on.
Yes, we're going to be giving you updates on treatments, on vaccines. On what's going on right now.
Of course, we will be talking about what's going on in America.
Voter suppression.
Politics and all of that. It promises to be a really great show. We would just want to encourage you to be there, invite someone, tell them about the show, put it on your calendar right now so you don't forget. And
guess what? Next week, we're also going to be streaming on Instagram as well. So we're going to be on YouTube, on Facebook, and on Instagram. So you can catch us on any of these platforms. Right now, we're just doing YouTube, but we just realized, we found out that technology will allow us to have the same format, have the guests.
We're learning something every day.
And also stream live on Instagram. So tell your friends. Instagram is a lot. It's a lot more accessible for folks. It's just one click away. In fact, they're probably on Instagram right now.
And then in the next couple of weeks, we're going to be doing a great show, Battle of the Sexes. So it's going to be a game show, and we're going to have the men versus the women.
And of course, we're going to win.
You see, PF always trash talks. I don't know why he does that.
What I don't understand is there a question? Is there a question about who's going to
Going right back to what I was saying. So if you are interested in being one of the contestants, please reach out to us.
But that's not fair. That's not fair.
What's not fair?
That's not fair.
What's not fair?
Okay, never mind. Don't worry. I'm going to choose my contestant.
No. You're not choosing anything. The people. If you think you are great on you'd be great on a show like that, kind of like a game show, Jeopardy style show. If you think you'd be great on that, go ahead and reach out to us on the NCH app, on the NCH.
Or you can reach out. You can DM us.
Yes,
or you can slide into our DM.
Yes, on Instagram. PF is really distracting me from my announcement. On the Live with PF and Pastor AK. So follow us on Instagram, and it's Live with PF and Pastor AK. And just send us a DM that you're interested, and we'll reach out to you if you want to be a contestant. There will be prizes. There's great stuff to be won. So
my problem with some of these things that we do, I don't get any of the prizes. Why?
Because just imagine that you're in the commission that does like the what do they call it, like the lottery. Yeah, people who work, or family members who work for the lottery commission don't contest. It's just the thing.
Is that fair?
Yes. Yeah. I don't know.
It's not fair.
It is what it is.
Okay. Anyway, let's just.
Well, it's Pastors Appreciation Month, so that one is for you. So you get that. So. Happy Pastors Appreciation Month. We appreciate you as our pastor.
I'm not seeing any present.
No, we'll get you present, definitely, and that will be that one you can get. But but for the prizes, no, you can't get that. Sorry.
Anyway, tomorrow we have Synergy on Synergy is going to that's our married people's ministry. We have our Synergy event tomorrow.
It's on Zoom.
On Zoom. The link
will be on our app and on our website. So newchdallas.com. Yes, and go there and just click on it or send us a message or click on it. And there will also be a push notification if you have downloaded our app or you are connected with us in any way. We have your information. We'll be sending you push notifications. And if you click on the link in the push notification, it should take you directly to it.
Ladies Alive, Girl Talk.
Yes, on Saturday.
Real Talk with Girl Talk.
Oh,
and I won't be there.
No.
Real Talk
women
at Girl
only.
Talk.
On Saturday.
See, I have skills. Real Talk at Girl Talk. You guys should pay me for that. Anyway.
On Saturday at 11 o'clock, Tim gets into these moods and I honestly don't know what to do with him when he gets like that. At 11 o'clock, please don't forget. The last couple of times we've had it at 1 o'clock because we're doing a special thing, but we're back to our usual time at 11 o'clock. 11 o'clock,
Real Talk at Girl Talk.
And we'll be kind of digging down in what we're talking about right now, which is finishing the year out strong. 2020 is not a dud year. It's not a washout. It's not it's not about a do-over. It's actually a year that God himself will and has shown himself strong in the middle of all of the craziness. So we're talking about that, and we'll be dialing down. We'll be dialing down on prayer.
Real Talk
at Girl Talk.
Real Talk at Girl Talk.
We'll
make me a t-shirt that says Real Talk. No, I don't want a t-shirt that says Real
You
Talk.
can't make it that says at Girl Talk, but I think I'll make myself a t-shirt like this one on. And so as we come to the end of tonight's show, just want to again thank all of our survivors who were on the show tonight. I can't even tell you how much we appreciate you being vulnerable and sharing your story. I honestly believe that these stories tonight will save lives.
I want to just also add to that we are truly grateful. Reverend Sims,
and
Miss May, Zarina May, Dr. Jolaya. We have this show, and we try to be fun, and we talk about some serious things sometimes. But I think this is one of the most important shows we've ever done. For the people who are going through it, for the people who are married to people going through it, for the people who are related to people going through it. I think this is very informative episode.
And just knowing that there's hope.
There is hope.
Whether it's a diagnosis in your 20s or at 65, there is hope, and the Lord, is with you.
And please, it's going to be on YouTube. If you know anybody who this information will bless, send them a link from it. Thank you all so much.
Get your mammograms done.
Don't forget, Saturday, Real Talk
at Girl Talk. I really like that. Good night, everyone. And night, tomorrow. God bless you.
Bye.